Hello, good morning everyone. Myself Rama Bhandari. Today I'm going to do presentation about clinical assessment and management of Miss Kasi. It is a case study of diabetes ketoacidosis and suspected postoperative sepsis. First of all, I will do introduction. Mrs. Kasi is 19-year-old female, and then she has a history of type 1 diabetes mellitus, and she went for laparoscopy surgery 7 days ago, and it was for endometriosis, and she was admitted to the emergency department at 9 o'clock with headache, nausea, vomiting 2 times, and then diarrhea, 7 episodes of diarrhea and lower abdominal pain. And she was diagnosed with moderate diabetes ketoacidosis and suspected sepsis. She has poor history because she was confused and she couldn't tell her age correct, and then because of that it was really hard to take her history correctly. A to Z assessment. A to Z assessment is the primary survey tool which is used in emergency conditions and in emergency department, and it covers airway, breathing, circulation, disability, exposure, fluid, and glucose. It is a framework for clinical assessment, and because of this, it will be easy to identify urgent issues immediately. Airway. Her airway was patent. She was speaking, and there is a risk of aspiration from vomiting because she was vomiting many times, and there is a decreased mental status, and which may reduce airway protection. Breathing. Her respiration rate was 19 breaths per minute, and oxygen saturation was 95% on room air, and she was breathing spontaneously, and equal air entry was there, and her lactate is 6.3 millimole per liter, which suggests poor tissue oxygenation, which could impact her respiratory function. So we need to monitor her circulation. Her blood pressure is 86 over 62, which is very, very low. She is hypertensive. Her heart rate is 46 beats per minute. It is sinus bradycardia. And because of this hypertension and bradycardia, we need to do medical. It is the major factor for medical, and sign of hypovolemia, sepsis, and electrolyte imbalance. So we need to provide fluid immediately so that her fluid replacement will occur at right time. And her GCS was 14 out of 15. She was confused and disoriented, uh, and her eye opening was 4, verbal response was 4, and motor response was 6. She was disoriented to time, place, and person, and she thought like she is 42 years old, and her pupil was 2 mm, and risks of cerebral hypoperfusion, encephalopathy, and metabolic disturbance linked to diabetes ketoacidosis. Her mental status triggered to medical. Exposure. Her temperature was 39.8 degrees Celsius. She was febrile, and she had abdominal pain and itchy on laparoscopy site, which may be due because of her post-op infection. So that itchy and pain and her increased temperature suggests like surgical site infection. She in fluids. She is nil by mouth because of her vomiting, and she is dehydrated, and she has dehydration sign like dry mucous membrane and poor perfusion, and she had like hypovolemia, so we need to administer fluid to maintain her fluid balance. Glucose. She had confirmed diagnosis of diabetes ketoacidosis, and her blood glucose level is high, and her ketones is 7.9 millimole per liter, and her urine ketones are positive, which is 40 mg per dl, and she has confirmed DK, and her pH is 7.30, anion gap is 25, base excess is 11.2, which all indicating acid base imbalance according to the research. Medical triggers. Um, Her blood pressure is less than 90 over 60, and her heart rate is less than 50 beats per minute, and her temperature, she is febrile, and her GCS is less than 15, which all are the combined sign of diabetes ketoacidosis, sepsis, and hypoperfusion. So we need to do urgent medical and to prevent her from cardiac arrest and urgent situations. So we need to administer urgent treatment like IV fluid and antibiotic. Pathophysiology of decay. Absolute insulin deficiency, hyperglycemia, and positive ketone production, which breakdown lead to fat breakdown leads to acidosis, and hyperglycemia, metabolic acidosis, and increased ketone concentration seen in patients with type 1 diabetes mellitus according to research, and clinical manifestation have pathophysiological link to DKA and sepsis. Pathophysiology of sepsis. Infection lead to cytokinase storm, which lead to vasodilation and capillary leak. Because of that, blood pressure will become low and poor perfusion, and which leads high lactate and confusion, and then hyperperfusion. Electrolyte imbalance and bradycardia. Diabetes ketoacidosis causes potassium loss through urine and vomiting. She had lots of history of vomiting and diarrhea. And insulin shifts potassium intracellularly, and which causes hypokalemia. Bradycardia due to electrolyte shifts, according to the research. Diabetes interrelation of DKA and sepsis. Diabetes ketoacidosis weaken immunity. Because of weak immunity, there will be high chance of infection. People may get more infection easily, and then which can, because of that, sepsis will worsen and need insulin resistance. Both lead dehydration, acidosis, and electrolyte imbalance. Immediate management priority. First of all, we need to manage ABC: airway, breathing, and circulation. Her airway was clear, and her continuous GCS, BP, heart rate, and SpO2 monitoring. We need to monitor continuously about her airway, breathing, and circulation. Her airway was clear. Her breathing. Um, mm, so her SpO2 was 95 percentage, and she was bradycardic, and then hypotensive. IV fluid for perfusion. We need to administer IV fluid because her blood pressure was severely low, so it will help to perfuse. And we need to monitor her cardiac monitoring. We need to do continuous cardiac monitoring, and we need to do ECG to find out the changes in her heart. So we need to do ECG every 15 minutes so that it will be easy to monitor her cardiac. Insulin and electrolyte therapy. Insulin, egg rapid infusion with glucose and ketone checks. We need to adjust insulin according to the bedside check. So doctor had already prescribed egg rapid infusion with glucose and ketone checks. So we need to adjust insulin according to bedside check. We should check the insulin, and according to the result we will adjust the insulin and then we will give it to her. Potassium replacement is essential. We need to monitor her potassium according to within 2 to 3 hourly according to the research. Sepsis management. So for sepsis management, we should do blood culture before giving the antibiotic. So we will collect her blood and we will send it to the lab, and from lab we will get the result, and then after getting the result we will decide which antibiotic we will administer. Especially here in her case, can administer ceftriaxone plus metronidazole IV, which is spectrum antibiotic. So if her if she is hypertensive, after administering the fluid, then we need to administer vasopressor so that it will be help to prevent from hypertension. Multidisciplinary approach. In multidisciplinary approach, um, first of all we need to contact with endocrinologists for insulin therapy guidance so that we will get the better mm, we can provide better care. And then also we need to contact with surgeon because she had undergone for surgery 7 days ago. So and she had symptoms like infection from that side, so we need to contact with surgeon so that they will decide what to do. And after all, and then we need to contact with ICU team, and then so that they can provide advanced care. If she needed the advanced care, then they will provide advanced care. And then we should contact with nurse, so nurse will provide close observation and psychological support. In conclusion, Miss Cassis is deteriorated due to diabetic ketoacidosis and sepsis. So because of that we need to do medical, and it is really important to do medical if their vitals are really low, and if her heart rate and then if her blood pressure are severely low, if they are confused and if their GCS is low, then we need to do medical is really important to save people's life. If we do medical at right time, then we can save people's patients life. So it is important to do medical at right time, and then it will prevent from the shock, and then it will prevent from any other medical condition which may occur in that time. So medical is really important in this case. So in this case they did medical at 12:30, which was really good, and then she is all right now. If you have any question, then please ask me, and then I have provided the reference at the last slide. You can have a look. Thank you everyone for today. Thank you so much.